You know the material cold, but the second someone asks, "Tell me about a time you handled a conflict," your brain, it just goes blank and you ramble for 3 minutes without ever actually answering the question. Today, we're fixing that with one simple framework called STAR. Welcome back to Nursing Matters. I'm Christina. Interview preparation is where I've spent most of my career, and the STAR method is, totally without exaggeration, the single highest leverage tool I can hand you. Now, behavioral interviewing, asking candidates to describe specific past situations instead of hypothetical ones, is still the dominant interview style across health systems, especially for anything involving teamwork, conflict, or leadership potential. The logic's simple. Past behavior predicts future behavior a lot more reliably than a hypothetical about what someone might do. So if you're not preparing specific stories in advance, you're walking straight into the exact interview style that's hardest to improvise well. Some systems are also starting to layer in situational judgment style questions alongside classic behavioral ones, presenting you with a hypothetical scenario and asking you how you'd approach it. The STAR structure still helps here, just adapted slightly since you can frame your hypothetical answer using a similar situation, action, anticipated result shape, even without a past event to draw from directly. Now, there's also more use of panel-style interviews now more than ever, where multiple people ask questions in the same session rather than a single one-on-one conversation. That's worth knowing because it changes your eye contact and pacing strategy slightly. You'll want to briefly address the whole panel, not just the person who asked the question, when you answer. I worked with a nurse named Omar, prepping for a charge nurse interview. And when we did a practice round, his answer to, "Tell me about a conflict you resolved," ran almost 4 minutes long. And by the end, I genuinely couldn't tell what he had actually done versus what the situation around him had been. We rebuilt that same story using STAR and the exact same events told with the ratio we're about to cover, ran under 90 seconds and was dramatically more compelling. Same true story, completely different impact. He got the role, and he told me afterward the STAR structure was the single biggest thing that changed how his interview actually felt from rambling to confident. What I remember most about working with Omar was how much his physical presence changed once the story itself was tight. When his answers rambled, he'd fidget, lose eye contact, visibly search for where the story was even going. Once he had 5 clean stories rehearsed, his whole delivery calmed down because he wasn't simultaneously trying to remember what happened and figure out how to say it. The content and the confidence are more connected than people realize. So STAR stands for situation, task, action, and result. Situation sets the scene briefly, where, when, what was happening. Task defines your specific responsibility in that moment, not the whole team's. Actions, the meat of your answer, what you specifically did step by step. And result closes the loop with the outcome, ideally something measurable or clearly positive. Now, the single biggest mistake nurses make is spending 80% of their answer on situation and task and rushing through action and result in one sentence. Now, flip that ratio. Situation and task should be one quick scene setting, maybe 15% combined. Action should be the bulk of it, 60% or more, because that's what the interviewer actually wants to evaluate, what you personally did. Second mistake, choosing team stories instead of personal ones. When you say, "We decided to change the workflow," the interviewer can't tell whether you contributed versus what the team did around you. Reframe consistently to I language. I identified the gap. I proposed the change. I implemented it with the team's input. You're not erasing teamwork, you're just making your individual contribution visible. Third, I want you to prepare 5 to 7 flexible stories in advance, not answers to specific predicted questions. So a strong conflict story, a mistaken recovery story, a leadership without title story, a difficult patient or family story, and also a going above and beyond story. Almost every behavioral question maps onto one of these buckets. So you're not memorizing 40 answers. You're mastering 5 stories you can flex to fit different questions. Fourth, always have a real result, even for messy situations. Interviewers know not every story ends perfectly, and that's reasonable. If the outcome wasn't ideal, be honest. Valuable answer is what you learned, what you would do differently if it happened again. That's still a real result, and honestly, often a more memorable one than a tidy success story. Fifth, I want you to practice out loud, not just in your head. Stories that sound complete in your mind often reveal awkward gaps the second you actually say them out loud. Practice with a friend, record yourself on your phone, or just talk through it in your car. The gap between thinking through an answer and actually voicing it is bigger than most people expect. Sixth, and this is a smaller tactical note, have a strong opening line for each story that immediately orients the listener, something like this. This happened during a particularly short-staffed stretch on my unit. A clear opener line prevents that meandering. So there was this one time that eats up your 90 seconds before you've ever gotten anywhere. Seventh, if you're in a panel interview, practice briefly making eye contact with each panel member during your answer rather than fixating only on whoever asked the question. It's a small physical habit, but it noticeably changes how the whole room experiences your answer. Even a perfectly structured star story can fall flat if it's recited in a flat, monotone way. Let genuine emotion show through appropriately when you talk about a hard conflict or a proud accomplishment. Interviewers remember candidates who seem genuinely engaged with their own story, not just reciting a memorized answer. Now, one more note on handling curveball questions and follow-ups after a star story. Interviewers sometimes probe further. What would you do differently? Or how did the other person respond? Don't panic if this happens. It usually means your story landed well enough to generate real interest. Answer honestly and specifically using the same structured thinking rather than getting flustered because the conversation moved beyond your rehearsed script. It's also worth preparing a couple of thoughtful questions to ask the interviewer at the end, since this part of the interview matters more than a lot of candidates realize. Questions about the unit's current challenges or what success looks like in the first 90 days signal genuine engagement and often leave a stronger final impression than one more polished answer would. And finally, keep each story to roughly 90 seconds to 2 minutes when spoken. Longer than that, you risk losing the interviewer's attention or burying your key point. Tight and specific beats, long and meandering every single time. All right, so common mistakes I want you to avoid. The first mistake, memorizing your stories word for word like a script, which can come off stiff and rehearsed rather than natural. Know the structure and key points, not a verbatim script. Mistake number 2, picking stories that are too old or too minor or feel too they just don't feel relevant. Aim for examples from the last 2 to 3 years whenever possible, showing your current level of skill, not something from a decade ago. Mistake number 3, forgetting to actually answer the specific question asked and instead delivering a prepared story that's close but not quite matched. Listen carefully to the actual question and adapt your chosen story's framing to genuinely fit it. So let's move on to listener mailbag. Someone asked, what if I genuinely can't think of a good story for one of the 5 buckets? It's totally normal, especially for newer nurses. In that case, borrow from clinical rotations, group projects in nursing school, or even a non-nursing job, as long as you're honest about the context. Interviewers care more about seeing the underlying skill demonstrated than about it happening in a hospital specifically, especially for entry-level roles. Another listener asked, is it okay to ask for a moment to think before answering a tough behavioral question? I love this one because it's absolutely okay and it often makes you look more thoughtful, not less prepared. A brief pause, let me think about a good example for that, followed by a well-structured answer beats a rushed, disorganized response every time. I can think of one example. I was a part of a panel interview where I was one of the interviewers, and I had it was a nurse manager who literally took about 30 seconds to think before she spoke. But when she spoke, it was amazing. She gave the absolute best answer. So while all of us as interviewers around the table were feeling a little uncomfortable, we were absolutely wowed, and definitely she took the time she needed to answer that question. So our Scrubs to Signed program on rnnet.org includes a full interview prep module, star story building worksheets, and mock questions that you can practice, and they're organized by specialty. So you walk into your next interview with real stories rehearsed, not improvised under pressure. Check out Scrubs to Signed at rnnet.org. So let's talk about your next action step here. Let's recap the big pieces before your homework. STAR is situation, task, action, result, with the ratio flipped so action carries 60% of the story. 5 flexible stories beat 40 memorized answers. Use I language over we language. Real results, even from messy situations, and practice out loud, timed at 90 seconds to 2 minutes. That's the whole system. This week, write out just 1 star story, your strongest one, using the ratio we talked about today. Then say it out loud, timed, and adjust until it lands right around that 90-second area. 1 well-built story is a template you can adapt for the other 4. That's it for today's episode. If this message resonated with you, please be sure to like and subscribe wherever you stream your favorite content. If you know a nurse with an interview coming up, please share this with them. As always, I appreciate you listening today, and remember, keep going because nursing matters.